For proper positioning in the chair, make sure the patient's buttocks is completely back in the chair. Hips and knees should be positioned at right angles, making sure that their shoulders are relaxed and elbows are placed on armrests, free to move. To put a leg rest onto the wheelchair, you need to line up the 2 holes with the 2 pins on the wheelchair. Swing the leg rest in and then assist the patient with putting their leg on the leg rest. There are standard leg rests as well as elevating leg rests. If a patient has an elevating leg rest, this can be helpful for comfort as well as elevating the leg for edema control. To elevate the leg rest, pull on the lever on the side of the leg rest while simultaneously supporting the leg rest. The same must be done when lowering the leg rest. Support the leg to make sure it does not drop abruptly. To swing the leg rest off, you need to push on the lever and swing the leg rest off, removing the patient's leg from the leg rest first. The leg rest can then be lifted up and removed from the chair. There is a special type of leg rest that should be used to support residual limbs of our amputee patients. They attach just like the standard leg rests, however remain at the level of the seat of the wheelchair to support the residual limb. The residual limb should be straight and well supported on the leg rest. A lumbar cushion may be issued for proper positioning in the wheelchair. The cushion should be placed behind the patient and tied to the chair, supporting the lower curve of the back. There are several types of cushions that a patient may sit on. The standard cushion is a foam or a general use cushion used for comfort. This cushion is typically blue, and all cushions should be tied to the chair for safety purposes. There are several types of specialty cushions that are used for pressure relief. There are cushions with air, gel, and memory foam. Some cushions have a pommel or a hump that should be positioned at the front aspect of the chair. Also, air cushions such as row hose may be used to prevent further skin breakdown. A hip abductor wedge may be used in sitting to properly position the legs in the chair. The wedge is placed between the knees, and then the straps are attached around each leg and velcroed to the top. To remove the abductor wedge, just unvelcro the straps and remove the pads. Patients come to our hospital with several types of precautions. The first one are hip precautions. A patient should not bend past 90 degrees. They should not cross their legs, and then they should not roll their leg in. Another type of precaution is sternal precautions when someone has heart surgery. They are not to lift more than 10 pounds. They should not push or pull on anything with their upper extremities, and they should not lift their arms above their head, greater than 90 degrees at the shoulder. Patients also come into our hospital with spinal precautions after a surgery. There is no bending at the hips, no lifting, or no twisting, commonly referred to as BLT. Arm troughs can be used when a patient needs help with positioning of their upper extremity. A foam cushion is placed on top of the trough, and sometimes a Velcro strap is used to maintain positioning of the arm within the trough. Another type of positioning device for the upper extremity is a lap tray or a half tray. Sometimes a foam wedge or a pillow is placed on top of the tray to help with edema control. The tray does flip down, however, should be removed for all transfers. Several types of slings and positioning devices may be issued by the occupational therapist. The first one is a white CVA sling. To put on the patient, put one of the white cuffs around the affected forearm. The sling should be placed under the arm, not around the neck, and the second white cuff should be placed in a manner that will support the wrist. The second method is the incorrect way to put on the sling. You do not want to just have the arm hanging from the neck. Another type of sling you might see is called a give more sling. It is the black sling that a patient might have in his room. To put the give more sling on, you place the unaffected arm in the loop, making sure that you have the words facing out on the black square. The square should fall about the middle of their back, and then the sling is placed around their back and their hand placed in the hand grip. Then secure the portion around the elbow, making sure the hand is in that supported position. These slings are meant for transferring the patient and should be not left on while in bed or in the chair. The isotoner glove is used for edema control. The seams should be placed on the outside of the glove with the isotoner symbol facing out. Wrist splints also may be issued by the occupational therapist. The first is called a resting hand splint. There will be several Velcro straps attached. Make sure the wrist straps are snug, but not too snug, and the wrist is properly positioned. A wearing schedule will be placed in the patient room. Another type of wrist splint, may be called a wrist cock-up splint, is used to support the wrist in a neutral position. Usually these splints have several pieces of Velcro that need to be fastened and a piece that slips in between the thumb and the first finger. Again, the occupational therapist will issue a wearing schedule. Make sure you check the skin after removing all hand splints. device that you may see in the room if a patient has had a total knee replacement is a CPM, known as a continuous passive motion machine. It's used to increase knee flexion, and the PT will fit this device and a sign will be posted in the room regarding a wearing schedule. To place this machine on the patient's leg, you need to line up their knee with the knee joint of the machine. You then place their foot in the heel cup and fasten using the Velcro. The machine has two other Velcro pieces that fit around the patient's leg. They're not meant to be put on tight. They should be loosely put on there to hold the patient's leg in the machine. Make sure the patient has the remote prior to leaving the room so that if they need to stop the machine for some reason, they are able to do so.